Hey everyone, this is Maiko. I'm a physical therapist in Southern California. Hey listen, this is the final video I'm doing for this series sharing about the principles of the movement system impairment syndromes. Now just to recap what I've shared from the contents from the past 10 days or so, the body takes the path of least resistance. The way that we do our everyday activity is important. Let's see, the third and the fourth were the concepts of relative flexibility and relative stiffness. We also learned that the body hasn't taken kinesiology class, right? They don't follow the rules. Where we move too much from is where it usually hurts. I've also shared about the motor control being important, and so is the quality of movement and exercises. And that we need a standardized movement exam to recognize patterns, and about regional interdependency because everything is connected. So for anyone who's not familiar with physical therapy, I hope you're appreciating how much a physical therapist has to know to do a good job of evaluating treating patients. I don't want it to be kept a secret anymore, The reality is, the public still doesn't know who physical therapists are or what we do. The reality is there's still too much variability in how the patients are being treated. So if a person sees 10 different physical therapists with the same problem, probably going to get 10 different treatments. And you'd be lucky if you're given a movement diagnosis from one of your physical therapists. And that's the reality. It's still a big problem. Let's say when I get ill, I go see a doctor so the doctor can determine my diagnosis, right? Because the diagnosis helps the doctor choose the right course of treatments for me. For PTs to be known as the movement professional, the movement system professional, we have to start promoting movement-based diagnosis. Actually, right now, APTA is trying to collect all kinds of movement-based diagnoses from across the nation. Putting a movement diagnosis on the patient lets the patient and the other healthcare professionals know that we've actually figured out something about the patient. And we're not just a technician anymore. Physical therapists used to be just, all they had to do was follow exactly what was written on the prescription. But now, unfortunately, doctors don't have the time to do physical examination. And frankly, physical therapists are better trained to figure out the cause of the pain. We're best trained professional to prescribe the exact exercise that the patient needs, because we know how to diagnose the patient's movement problems, right? Not medical diagnosis, but movement diagnoses. So by promoting diagnoses for physical therapy, it really helps us guide our patients better. It will elevate the recognition that physical therapists deserve among the public and the healthcare professionals. I just want to thank all of the physical therapists who came before our generation, who've fought so hard so I can work in a physical therapist-owned clinic, and I have the freedom to do an evaluation. And it's because of their pioneers' hard work that we've moved to a clinical doctorate degree to become a physical therapist. And I think it's really time to start pushing movement diagnoses so we can better serve our patients. I hope this video series has sparked some interest in learning more about the movement system. This August, I'm going to be hosting the Los Angeles Movement System Seminar with actually some of the nation's premier physical therapists to learn about the movement system impairments of the lumbar spine, hip, and knee joints. So please come and join us for the 4-day course, full of lecture and lab time with amazing lab assistants from both the US and Japan. If you've already taken an introductory MSI course, please check out the October Advanced Lower Quarter MSI course in St. Louis. I'll put the links down below. Thank you so much for watching. Please subscribe to the Nexus Motion YouTube channel so you can continue to learn about the movement system. And as I say, Nexus Motion's motto is move better and live better. So with that, I hope to see you next time. Bye.